Bubonic plague. Bubonic plague is a disease transmitted by fleas on infected rodents biting people who are hunting. It started to spread in China and killed 200 million people in medieval Europe in 7 years. Symptoms in the first 24 hours include high fever, bouts of chills, black tongue. On day 3, orange-sized swellings in the groin, armpit, or neck called buboes. On day 5, black death spots on the skin, nosebleeds, and blood in the urine. Usually patients died within 48 hours. A few genetically lucky people have survived the disease thanks to their immune system, but this number is very low. Ebola. The Ebola virus is an extremely deadly disease due to its severe symptoms and physical bleeding. The first victims appeared in 1976 in Sudan and the Democratic Republic of Congo. It is named after the Ebola River where the first case occurred. The virus attacks the immune and vascular systems and usually manifests itself with fever, fatigue, muscle pain, and severe headaches. Later, more serious symptoms appear. It causes bleeding from the eyes, gums, and nose because the virus is literally rupturing your blood vessels. The Ebola virus is transmitted through contact with urine, sweat, feces, semen, vomit. If you see someone with symptoms of this virus, you should start running immediately. Ebola has a terrible mortality rate, which means 9 out of 10 people die, so luck must be with you. Tuberculosis. Tuberculosis is an infectious disease that slowly and insidiously destroys its victim. Unlike other deadly diseases, it is not transmitted through physical contact. It is passed to you by inhaling the germs released into the air by the carrier of tuberculosis. The bacteria in the small airborne droplets is called Mycobacterium tuberculosis, which is very strong and difficult to kill. This bacteria spreads into the air when the carrier coughs, sneezes, or talks, and can live outside for hours. Once you are in the same environment, it settles in your lungs, where it multiplies for 2 to 10 weeks. The victim does not mind the coughs at first, but over time, the coughs cause different symptoms such as bloody sputum, night sweats, and fever. The chance of surviving this disease without medication is 60%. If you start medication, it will take at least 6 months. Leprosy. Leprosy is a chronic infectious disease caused by the bacterium Mycobacterium leprae. It can be contagious if you spend too much time with an untreated patient, so it is not a highly contagious disease. The disease is usually characterized by red spots when touched and numbness in the fingers and nose. If left untreated, organs can suffer nerve damage and fall. In the past, people with this disease were ostracized from society. Stone Man. Stone Man disease is an extremely rare and progressive genetic disorder that causes soft tissues in the body to ossify over time. This progressively limits the patient's mobility and causes the joints to petrify. It is a 1 in a million disease in the world.